Now, a week-long lockdown has been imposed in Delhi to try to prevent the collapse of India's healthcare system because of rising COVID infections there. These are some of the numbers. In the past 24 hours, India recorded over 250,000 new cases and 1,761 deaths in the last 24 hours, bringing India's death toll to over 180,000 people. But officials believe the actual true number is higher than that. Well over 3 million people have been vaccinated yesterday, bringing the total number of vaccinations in India to 127 million people. But that, because of the size of the population, amounts to only 9% of the population getting a vaccine. Several regions have tightened restrictions to deal with the increase, and 9 of India's 36 administrative regions are under nightly curfews, including in Kerala in the south and Punjab in the northwest. Chandigarh and Rajasthan, also in India's northwest, have instigated weekend lockdowns, and several more areas have entered a full lockdown, including Delhi, from where Sky's Neville Lazarus reports.
India is in the grip of a second wave, a deadlier and fast-spreading one this time around. Young and old, the virus has spared no one. Taking a breath is a struggle. And doctors constantly monitoring every patient. Many just lifeless because of the disease. The Bandra Kurla Complex COVID Center, with over 2,200 beds, is one of the largest facilities for COVID-19 patients. Sky News was given exclusive access. It was set up last year as Mumbai, India's commercial capital, was ravaged by the virus. A year later, a repeat. The city and state is reeling once again with record numbers. The facility is almost full.
In the country, I can vaguely tell you that in last few days or few weeks, there is an upsurge of number of COVID patients, which is labeled as a second wave. Undoubtedly, considering the number, we can say the second wave has more virulence than the first wave, but certainly death rate is not that much.
Every day this week, India recorded over 200,000 new cases, the highest anywhere in the world. Across other states, the situation remains grim. In Ahmedabad, patients attached to oxygen cylinders wait their turn in ambulances parked outside. Hospital beds, ventilators, and even medicines have run short. Family members wait for a refill of oxygen cylinders. That is in short supply, even in the national capital, Delhi. The alarming number of cases has put tremendous stress on the health services. Many cities and states have put in restrictions. Here in Delhi, there is a lockdown for the whole week. Only essential services are allowed to be on the road. The fear of a national and prolonged lockdown has caused thousands of migrant workers to rush to railway and bus stations to return home. As the country struggles to deal with the pandemic in larger cities, the fear is for the poor and vulnerable in rural India, where health facilities are inadequate or almost non-existent. Neville Lazarus, Sky News, Delhi.